Doctors are worried about a particular type of cancer. It is not that common, but there has been a dramatic increase over the past 2 decades.
That's right. We're talking about esophageal cancer. Seven's on call with Dr. Jay Adlersberg with more. Jay?
Rob, cancer of the esophagus has increased over 400% in the last 2 decades, and it's a disease that is 5 times more common in men than in women. Why this cancer is on the rise is baffling experts. Bart Frazita is now a patient-to-patient volunteer at Memorial Sloan Kettering Cancer Center. He helps other patients adjust to the diagnosis and treatment of cancer of the esophagus. The esophagus is the muscular tube that moves food and drink from your mouth to your stomach. Bart was diagnosed with cancer of the esophagus 2.5 years ago. His symptoms before that had been vague.
There was no pain, actually. It was just in swallowing, things would get stuck in my esophagus. And that was the telltale sign that there was something wrong in my mind. And agita in the Italian way, or heartburn, was certainly something that was there and had been there for a few years.
White men are the most common target of this type of esophageal cancer called adenocarcinoma. It develops in the lower part of the esophagus. Another type which develops in the upper part of the esophagus is called squamous cell esophageal cancer and is more common in black men. This one might be linked to smoking. Doctors have no idea why it's 5 times more common in men.
It's important that we get a greater awareness of this disease because it is becoming more common.
Warning signs that might suggest a visit to the gastroenterologist include difficulty or painful swallowing, severe weight loss, and severe chronic heartburn that has lasted for a year or 2.
Obviously, we all have occasional upset stomach, but in people that have chronic, severe, recurrent heartburn, there may be a consideration to see their physician and perhaps be evaluated by a GI specialist.
Most people who get esophageal cancer have none of the known risk factors. Reducing risks means no smoking and drinking alcohol in moderation. Eating fruits and vegetables may reduce your odds of this disease. For more on esophageal cancer, see our website at 7online.com.
All right.